Directed from Ministry of Health, Ghana Health Service Director General, and directed from Ghana Health Service, and then team from Regional Health Directorate, the contractors, and then team from Fomina. We would like to thank you for coming. We would like to start the program, but before then, we'll call on the PRO of Ministry of Health to introduce the minister, the deputy, and then the other members. And then later we'll also introduce the other members here to you before we start the meeting. So I'll hand over to the PRO to continue. Thank you.
Thank you. So good morning once again. Good morning. So we are here with the Honorable Minister for Health, Honorable Bernard Boboy, Doctor, is here with us. Then the Deputy, Honorable Adelaide E.T. is also here with us. We have the Financial Controller of the Ministry of Health, Mr. Francis Nunu. Then the Director General Ghana Health Service, Dr. Patrick Kumar Aboy. Then we have Director Infrastructure, Mr. Benjamin Kansa. Then we have Mr. Kwame Sapo also here with us. So I leave the rest for the Revenue Director.
Yes, thank you. As I said, we have Director General Dr. Kumar Boaji. The Director has Dr. Ebu Hammond, and then myself, the Regional Director. So we'll call on the District Director also to introduce the district team before we start.
Thank you very much, Regional Director of Health Services. We also have the digital health team and then a dancing of hospital management team here. The digital assembly are also here, so I'll take the opportunity to introduce them.
More. He was a hands-on man at the site. And then Mr. Owari, that's the local chief, the coordinator of all activities. So that's the NMS team for you. Thank you.
So we'll call on the District Director to give us a short welcome address.
Director, I've been just reminded that Mr. Freshu is now chairman, not deputy again.
Chairman, you will start with opening prayer before we start.
We took the month of July and August to do trainings on equipment and machinery within the hospital. Then in September, we had a week of opening to the public for people to walk in to see how the facility is well endowed and constructed. From 6th of November until date, we've been seeing clients on both admission and OPD basis. And I want to give some statistics on what we've done so far. So since inception, we've been able to see a total of about 13,000 clients with these number of staffs. We have a total of 97 workers. Out of that, we have 5 general medical officers, general practitioners, myself, an obstetrician gynecologist, and then we have a surgeon who is also having a subspecialty in urology. We also have a dentist, so that will make us about 8 in all for the medical team. We have a total of 13 general nurses, a number that we think is a bit woefully inadequate for the 13,000 people that we have seen so far. We have 11 midwives, we have 23 support staff, and then for our other staff, we have about 36 people. And we've been able to get on board 11 casuals, which we inherited, some of which we inherited from the old health facility. I'll go on to give the details. So far, we've done about 2,100 hospital admissions since inception, a total of about 470 deliveries. And out of that, about 350 were vaginal deliveries. We've done cesarean section of almost about 150. We've also done other surgeries in total, other major surgeries in total, 209 minor surgeries, which would include circulages and surgeries of the sort, about 19. So in total, for major and minor surgeries, we have 228. And we've taken out cesarean sections on this one because it's a maternal and newborn hospital, and that is 150. We have a few challenges as a facility. Since inception, at least we've heard that the November NHIS reimbursement has been given, but we have not received any money. Our submissions are up to date. We've been able to send all our claims, but we haven't received any reimbursement. We have major power outages. In the evenings, the power fluctuates. It goes too high, and then the system has to shut off. Or it's too low, and so the system has to shut off. And we've even had problems with some of our machines. The AVR had to go off because of the frequent power outages. We've tried to resolve that issue by bringing on board ECG. We're able to get them from Kumasi to come. They came and did some settings, but were free of the problems for a while. Currently, we are still having the challenges, and even yesterday we had to vote quite a high amount of money for fuel to be able to keep our generator on when the problems arise. We currently do not have any vehicle for service delivery. We have an ambulance, we have a bus, a staff bus, but we would need a pickup that would take money to the bank. Sometimes you need to make a few announcements, you need to move staff to in and out of meetings when the regional director calls. So currently we are unable to, we wouldn't want to take 2 or 3 people in a whole bus to Kumasi when we are called. So we need a pickup for that purpose. I'm sure this, we all bear witness, we're from the road to the facility, from the main road, the Methodist Church to the facility, the road is not good. It has quite a number of potholes, and it's the only existing road to the hospital. So if there's any blockade on that road, access to the facility will be difficult. So I want to believe that there will be plans to be able to create another road so that we will not be in trouble if there's any blockade. I mentioned the details of the staffing, and I'm sure that if you are versed in health work, you know that we are understaffed. Currently, because of the staffing problems, we are not running the whole hospital. We've closed some sections. The emergency, for instance, is a ward where we are admitting almost everybody. So we stabilize you in one, we triage, stabilize you in one corner, and then within the same ward, we move you when you are stable to another side. Our staff are doing 2 shifts a day, 12-hour shifts, instead of the usual 8-hour shifts. They come in the morning from 8 and close at 8 p.m. Then the next batch will come. And the maximum you get at every point in time will be about 2 professionals and then 1 add-on to support. That's what we are working with. And so we hope that our gaps will be filled. We are also yet to be linked onto the LIMS, which is the software that is being used everywhere by health workers. We don't have access to the LIMS yet. And the hospital didn't also come with any software for patient care. And so we are hoping that we'll be able to get hooked onto the LIMS quickly so that it will help us to be able to care for our clients whilst we retain all the information that we gather from them. For the inadequate staff, I've tried to put together what we think will help us bridge the gap. We have a well-resourced pediatric ward with a neonatal unit, so we'll need a pediatrician, at least 1 in the meantime, to support. We would need a minimum of about 20 midwives to help support what we do. We think about 30 professional nurses will help, 3 biomedical scientists will be necessary. We have an ultrasound machine. I'm able to do scans with 1, but we'll need a sonographer who will be doing general scans. We have an X-ray machine, but we don't have a radiographer. We also think that with this well-resourced emergency unit, we'll need a minimum of about 3 emergency nurses and 3 critical care nurses to be able to help. When we go through the hospital, you'll see that we have a very beautiful eye center, but we don't even have an ophthalmic nurse, not to talk about an optometrist or ophthalmologist. We also have an ENT chair with all the equipment that is required to see to people's ears, but we don't have an ENT nurse. And we think that at least 2 of them will be necessary to help us achieve patient care within the hospital. We also have a physiotherapy unit. We don't have anyone, so we would want to get at least 2 people to run the physiotherapy unit. We also believe that in caring for pregnant men and children, you need to have a dietitian and a nutritionist. these are people who are very important in this, the care of these categories of people that we are very much interested in. So at least 2 from this category will be helpful. The last on my list, but not the least, is a driver. I would think we need 2 drivers. We have an ambulance here. We have a staff bus. We are hoping to get a pickup, and so we want to get drivers to support the work we do. I'm very grateful for your attention. Thank you very much.
So we'll call on our Director General to give us a short address.
Thank you very much, Honorable Minister, Deputy Minister, our guests from Medical Director and team. We are very grateful for the good work we are doing. Honorable, this is a place I took a very dangerous risk, and I think it paid off. I remember I had to tell the big house, please, let me start the facility before we commission. But they also started very well, and we've not had any problem in commission. So I want to thank them for not bringing this place to such a quick start. And with the number of patients they have seen so far, even with all the challenges. I want to thank NMS, yourself, and all of them for this wonderful work that has been done together. I have only one simple appeal, and that appeal is on behalf of not just you but everybody. It's the issue of seed funding for these new hospitals that we start. The lights are on, but they don't have money. But the lights have to be on. They have to buy petrol and go up. They have to stock their pharmacies, but it's no, and especially with the delay in health insurance, I think they are waiting there. I think it's November that you will have qualified. Yes. So maybe even if you get it, you have about 7 months of working with virtually nothing. And I think that is something that we really must institutionalize to ensure that such hospitals are given some seed fund to start. Not just security, everything, they are all areas that they have to spend from day one, money or no money, because of protection and everything. So I don't have much to say, but thank you to ensure that. And I'm sure we're going to have the same problem in that place, that we can ensure that at least at the beginning there's some seed fund allocated for such a place, and that's what you can use to get a pickup and all those things to be able to do it efficiently. Thank you very much, and thank you for visiting us. Even though I came with you, you are visiting us.
I don't know whether the contractor
yes.
will let me say something.
NMS. How are you? You said something, your chairman.
Thank you, Minister. NMS is very honoured to have been invited to collaborate with the Government of Ghana and the Ministry of Health to deliver these centres of medical excellence. The Fomina Hospital opening is a very proud moment. It comes after years of work of a very large task force of contractors, subcontractors, and of course all of the very many parts of government that have supported the program along the way. So we're very grateful for that. I'm very proud to have been able to succeed in bringing this facility to bear for the future health well-being of all of the people of the region. The medical doctor outlined the many high-quality opportunities for skilled health workers here. Job opportunities in the rural areas are important, as we all know, and also even long-term opportunities for security staff, facilities management personnel. So this is also not just a centre for health, but a centre of employment. And I think that's where one of its greatest values lies. And at the same time, all of these people coming together to improve the quality of life in the rural areas. So really it's part of the system that we need to put into place to support sustainable rural living. And what we in NMS are focusing on doing is delivering healthcare, education facilities, clean water, and jobs in agriculture. And working with the government, we look forward to promoting all of these things and to create better living conditions for everybody in the regions. Thank you.
So I call on the Minister to address us.
Thank you very much. First of all, let me thank staff of the hospital. Mercy, you see, Mercy tried to bully me. That's my senior in school. It's been a long time I saw her, but I'm happy that this morning we've met at her facility. The Director General is telling me that she's extremely hardworking, and I'm not surprised because she went to my medical school. So let me thank her and her team. Like I think I said yesterday when we visited, the last time we went to the choir, that any health worker you meet at the district, at a place like this, has already made huge sacrifices for the nation just by working at such a place. So I think they deserve a round of applause. I say so because myself, I work in the district. Although I grew up in Accra all my youthful years, all my working life, I was working outside Accra. And it's because, although I know that there are a lot of sacrifices you make, I was more interested in the peace and tranquility that comes with outside the city, big cities. But you know, if you study the drivers that drive people to the city, you realize that in the cities you get opportunity to do some extra work sometimes. You have the luxury of all kinds of international schools or whatever school you want your boys to attend. And a lot of positives. Your roads sometimes are very, very good. But in the district, you make a lot of sacrifices. Plus, when I was in Chemi, after work, all you have is to listen to radio. And I listened to radio for a long time. If you are lucky and they call you that there's a case, you are even happy because there's no place to go. So, I mean, it is one thing that I always like to start appreciate and to thank you for being here. But like I said in Bekwai, being here now doesn't mean you finish here. It's a journey. And so be inspired and encouraged. I'm glad that Director General worked with some of you to start this hospital, if not even at full capacity. The beginning is always challenging, but with time, things will fall in place. This facility was part of some 7 health facilities, about 6 and 1 accommodation facilities that was signed by the Ministry of Health in 2012. So it was a design, construction, and PPE that came with its funding. And NMS Infrastructure signed the contract with them, or the Ministry of Health, let me put it that way, signed the contract with NMS Infrastructure. The locations for these 7 facilities included Dodowa, Fomina, Kumewu, Garu, Sekendi, Abetifi, and Takradi. And at Takradi, that's where you have the staff accommodation. At a project cost of $175 million. Now, each of these facilities actually is a 120-bed hospital like we have here. That's the capacity of the hospital, with the services that the Medsu mentioned. So it has all the ingredients of a fit-for-purpose primary healthcare facility, which means that almost everything that must be done when it comes to the basic things in health can be handled here. And I'm happy that even with the hospital running with just about 97 workers. We have over 200 major surgeries and all that. All these cases, had it not been for this facility, it's possible they would have been traveling a distance to go and have, let's say, cesarean section. And the closer a facility is to the community, the less likely that a woman will die out of pregnancy because they are traveling on the journey. So, I mean, we are happy that we have this facility up. There are three things. I've written all the challenges. Normally when I come, I'm interested in the challenges because that's why it's one of the reasons why we are here. I mentioned yesterday that the president, in asking me to come to the ministry, mentioned three things that we have to work on. First of all, the charge is to make sure, the first assignment for the president is to make sure that whatever state of health we have, we work to improve on that. And one of the best places for the Ghanaian, the ordinary citizen to say that, oh, things have improved, is the experience in the hospital. So if a Ghanaian used to sit at the OPD for 1 hour, 2 hours before someone sees them, now that you have a new facility, they will not travel far. It's likely that within a short time they get attention. So we have an assignment to make sure that there is an improvement, not to be told by us, by the experience that a Ghanaian has. The second one is to make sure that we relate well with health workers, amongst ourselves, and also with the public. And it's one of the reasons why we have come, we're in Ashanti region for a week. After some time we'll go to another region. There is no Ministry of Health or Ghana Health Service without our facilities like we have here in Adansi. It is what you do that comes together to make the ministry, and for that matter, the Ghana Health Service. And so we are happy that we have gotten closer to you. Anytime you get close to the ground and you meet challenges, they appear different from when they are presented to you through reports. Because when you come, then you even can visualize the challenge and can remember some faces, and sometimes the one who even mentioned the problem. And so that is one advantage of coming straight to where the issues are. And once the DG was showing me some clearance that came and how we should do well, that you get some. I'm sure it's because we are here. So be rest assured that we will take a good look at the staffing situation, especially. Now, I want to mention one critical issue, that a facility that was signed, a contract that was signed in 2012, by the time this administration came into office, my checks show that this facility was about 55% complete. So from 2016, let's say January 2017, this government has worked to make sure that the facility is completed and sees the light of day. Now, what does it tell us? It is a strong message that this Akufo-Addo administration believes in continuity when it comes to the work of the state. And I have to emphasize this because in the past we've seen some facilities abandoned only because it was started by another regime. And Kofanoche, the mother and child block that was in Kofanoche for over 40 years, started by Achampo, is a very manifest example that if we don't continue in the spirit of finishing what our predecessors started, Ghana will have serious challenges when it comes to developmental projects. And I believe that this government deserves commendation for continuing and finishing with all the projects that were part of this package. I know that I was checking with NMS, and out of the 175, I am told that about 38 or 40 million roughly was paid during this regime. There were earlier releases before we came. But sometimes a 175 million project can be jeopardized by just an outstanding of 5 million or 1 million. And so it is very important that we as leaders make it our business to complete and finish whatever project our predecessors started. And I'm happy that from here, from now, we are going to Kumewu, which is also part of the NMS package. And I'm sure the ministry will be moving to Western region so that Chairman Fred will go and see the flood accommodation units at the European hospital. We have to go there before he leaves, so that he will experience the work that you have done. Apart from this, and I think it's important that we are candid and honest with ourselves. Sometimes someone will say that, oh, I think out of the 7, Dodowa Hospital, which was part of this project, was completed and finished before this administration came. And sometimes when you mention that, oh, this government has done well to finish Formina. Oh, Formina, don't mention Formina. It was started during somebody's time. If we continue in this business of not also commending or crediting people who finish projects, that's where you have a situation where people don't touch projects that were started before. So it is important to commend the one who commenced and also applaud the one who finished. That is a culture that we have to develop. The second issue that I want to mention is job opportunities for the youth. I hear a lot of people saying, oh, let's create jobs, let's create jobs. One of the best ways to create jobs is to put up a health facility. You have to recruit new people, professionals who have been trained, but you need those in the other category, they're not those who don't have special skills, but we can train to be of use in the hospital. From orderlies to kitchen staff to those who sell even for outpatients and all that. So I believe that one of the ways to create opportunities for the youth is to invest in the health sector, especially in health facilities. And on this note, let me assure my senior that we are going to work hard to improve on your staffing situation. I'll be speaking on your behalf to Director General, so that Formina is treated special.
Thank you.
Thank you.
It's also important to mention that in the democracy that we run, I believe that in the future, I like candid discussions. The needs of the state would emerge naturally based on the systems that we've created. But currently, as we speak, more often than not, if they are building 7 hospitals within a package, it takes a lot of lobbying and a lot of running around to make sure that you also benefit. And so, don't make a mistake. Honorable Esiama and his predecessors were very influential in making sure that Adansi North was remembered when it came to some of these facilities. When your project was hanging and was not getting attention, I remember that's his second deputy speaker, right? Yes. When I was in Parliament, he was sitting right behind me. And he didn't make anybody sleep in the government, ensuring that NMS gets the necessary releases so that this project is completed. I say this so that when you see such people, you can even encourage them to help bring a lot of things to your community. Finally, DG mentioned the issue of seed farms. And when I was at National Health Insurance as CEO, I remember the medical director for the Upper West Regional Hospital. I visited the hospital to see how health insurance was working within that entry. And he told me that, Doc, we don't have even one pickup. Can you help us from health insurance to get a pickup? And he mentioned the issue of their utility bills, and he mentioned something that they started the hospital without a seed fund. And so I think we must seriously start to consider and to make this seed fund as part of the package right at the beginning when we are building hospitals. And I did some rough calculation. I don't have a calculator here, but I went to present. So the mass is so 10% of 175 million is $70.5 million. And 1% is $1.75 million. 0.5%, half of that, we're talking about $850,000 plus. So, should we have a rule now going forward that any project you do, these were 7 hospitals, assuming you are sharing 1% of the project cost to all these 6 hospitals. 1.75 million. Each one will get some decent money to start life. And so, Director Infrastructure, because the only time that all of us are serious about finding the money, allocating the money, and see how to pay is during the conception, design, contract stage. If we don't discuss money for the hospital and they finish the hospital, in fact, maybe the chairman who started the project would be in Europe. But during the design and the discussion, everybody's around. So I think going forward is one of the serious things that we will be advocating for future projects. At least some percentage of the contract sum should be money set aside for the operationalization of the facilities. And I'm sure if we had done that, a lot of our issues would not have been an issue. So going forward, we'll do that. But in the meantime, I think what we can do to support the hospital is to engage seriously, like we are doing already, on utility payments like electricity. How much do you pay? Do you pay all? What is the time allowed to honor some of your obligations and all that? So on this note, let me thank you very much. I'm happy that Chairman is here. We would like to go through the facility, appreciate the facility, so that we can see the ENT bed without a nurse, and then the visuals would force us to bring.
Remember the hairnets, right?
We don't have much here. We don't have much here. That is the same as it was.
No. Is that infrared stuff?
You can just, if you wave it, once it's small, we are not using it. Once it's small, it's really small. You don't have to touch it.
I'm very sorry to see you. I spent some
She's a senior.
Oh, Debbie.
So we go to this side. Good Phoenix, they have a nice area for the kids.